Dear listeners, welcome to episode 9 of Thinking Psychologist. We have reached this far, and the statistics of the show are up the roof. The things that we are talking about has actually got your attention. Till now, what we have seen is how our mind is manipulating us into living into a different delusional world altogether, where we see living in the past and future. If you look at the total time, it's more than 70% of our daily life, and living in present is only a very small part. That creates a fundamental question that we need to ask is, are we really living in a world which is true, or are we living in a delusional world inside our head, or is it a matrix that we can say? Without going any further, we have got a really interesting guest today on the show. His name is Mark Grant. He's a clinical psychologist with over 20 years of experience in treatment of stress, trauma, and pain. His main interest and experience is in the role of negative emotions resulting from stress. With this, we would like to welcome Mark to the show and then ask Mark to quickly introduce himself and tell us about his journey, how he has come to this particular position and what he has been doing. Welcome to the show, Mark.
Thank you, Ash. Thank you for having me. It's great to be here, and I'm looking forward to talking about my work. So as you said, I've been working with chronic pain and stress-related symptoms for actually nearly 30 years now that I think about it. And how I got into it really is a very personal story. I was, like anybody growing up in a family, thinking, what the hell is going on in my family? What is it really all about? Why do I feel these things? And I was very curious to understand myself, to be honest. And I was also brought up in the Catholic faith, which really teaches you to try and help others, and that's the best thing you can do with your life. So that was very a motivation for me to study psychology, to understand others and to help others and to understand myself. And if there are any Freudians listening, then I will confess that by a strange, mysterious coincidence, my mother was a chronic pain sufferer, and I was the firstborn child. So I know that some subconsciously I probably wanted to help her too. Is that
Yeah,
enough? Yeah.
yeah, totally understood. You know, picking up this topic, Mark, that the intrinsic motivation that you spoke about was helping other people in the world. Once we talk about this chronic pain and chronic illness, what's different between this chronic pain and chronic illness?
Okay. So um, chronic pain is pain, of course, that persists longer than it should, really. So we understand pain as being a signal that something is wrong physically, and then the body heals itself and the pain goes away. That's from Descartes. And more or less from the beginning of that idea, there has been a problem that there are people who get pain that cannot be explained medically, that does not get better the way it should. And really, ever since Descartes, everyone has been thinking, what's going on with these kind of pain? And they're thinking, well, these people must be crazy. There's something wrong with them to keep saying they have pain when everything has healed. There's longer, da da da. And in the 19th century, a French therapist called Pierre Janet really discovered that these people had suffered some kind of trauma or abuse in their childhood, and that they were having kind of somatic symptoms as a way of remembering that trauma, and until such time that they can process it or resolve it. So it changes our understanding of pain. It means that chronic pain is actually part of an attempt to survive. Whereas normally we're used to thinking about pain that is chronic as having no survival value because the injury is healed, everything is okay, you don't need it. And there has been an experiment to prove this. So some researchers from the University of Texas in 2014 took some squid, and they cut their tentacles of two squid, and then they gave an anesthetic to one squid and left the other squid with no anesthetic. And they found that the squid that they didn't give any anesthetic to developed chronic pain. And they knew this because when they put predators with the squid with the chronic pain, if you like, were the best at surviving from attacks from predators, because their nervous system is more highly sensitized. So they've proven that, in actual fact, chronic pain has an adaptive survival function that nobody ever could have imagined.
Wow. So you mean to say the people with chronic pain have better survival chances and their reflexes are more strong?
Well, it's not quite so simple as that, because human beings are not squid, and
Yeah.
they're living in a more complex world. But really what it's saying is that their nervous system is more sensitized to threat, and it's a way of trying to keep them safe from further harm. Now, of course, that harm may not really be as real as it's imagined. And so the challenge becomes how to help those people, their nervous systems be more relaxed, more calm, more normal, so that they don't have to continue to suffer pain.
So there can be numerous kinds of chronic pain patient, isn't it, Mark? So
Oh, yes, absolutely. So you can have someone who was perhaps sexually abused as a child. You can have someone who has been in a motor vehicle accident, who has developed whiplash pain. You can have someone who has a conversion disorder, where maybe they grew up in a family where they couldn't express their feelings, so they got a headache or a stomach ache instead of expressing their feelings. So yes, there are many, chronic pain can come from many different causes.
So what's we see you are a specialist into a particular field of chronic pain. What is it all about? For example, if you could give us an example of one of your patient, and what happened with them, and what are the new techniques that you use to solve them, and especially what I'm interested in is knowing, Mark, is what is happening inside the brain of a chronic pain patient, and what are the best ways to help him out.
Sure. Well, first of all, the very fact that you're asking that question is a sign of how much the way we think about pain has changed. So 50 years ago, nobody really thought about pain in terms of the brain. But with modern brain scanning technology and more research about chronic pain, it has been discovered that the brains of chronic pain sufferers are functioning really very differently to people who don't have chronic pain. Their brain is overactivated, especially in areas to do with emotional processing. So although we think of pain as a physical problem, it's actually the parts of the brain that are responsible for processing emotions that are the most activated in the experience of chronic pain.
Mm-hmm.
So I won't go into. Do you want me to go into detail about that, or it's not necessary for
Yeah,
your audience?
our audience is mostly college students as well
Yeah.
as the working professionals, so they won't really understand what prefrontal cortex or whatever it is. So let's stick
Okay.
to
Okay.
let's stick to the
That,
basics.
that's fine. So you can. So we can say anyway that the chronic pain sufferer's brain is oversensitized to stimuli, and what actually happens is that when people have pain, we think of it as coming from the body to the brain, that the body is sending a signal to the brain. But in actual fact, it's not so simple. It's a two-way street. So chronic pain actually also involves the brain sending signals to the body, particularly the areas of the brain that are associated with emotional processing, but also to some degree somatosensory cortex, sensory processing. So really what's happening in chronic pain is that the brain is sending signals to the body to tell it that it's in pain. Spontaneously. Nothing, you have not done anything, nothing has happened, but your brain is sending these signals because really when the brain is trained to remember things. So if you experience pain for too long, your brain remembers it, unfortunately. And it can't forget it. And so it's just sending these electrical impulses all the time that you're in pain. And there are many areas of the brain that are doing that, but one area of the brain is the amygdala and the hippocampus, which is responsible for the fight-flight response, which I think everybody knows about that. So it's like your brain is really on high alert. And we want to switch it off. We want to calm things down, to get the brain into a more quiet, more normal level of activation. And traditionally, we would do that with psychotherapy, or we would do that with cognitive behavior therapy to try and teach people to change their thoughts, or maybe meditation. There are some challenges with those approaches. One is that meditation, as you may know, is not easy to practice. It takes a lot of discipline and persistence, and it's very frustrating. You don't feel you're making any progress, and so on. And another with changing your thoughts, the difficulty with that is that it's a very inefficient way to change your feelings, because your brain processes information, especially effective information, in a bottom-up fashion. So that means that really how you feel has much more power to control how you think than vice versa.
Mark, sorry, just at this point, whatever I have learned till now, not from the core, but from a lot of books and everything, what I have heard is the thoughts and feelings are always the same. If there is a positive thought, there's going to be a positive feeling. So we think about something and then the feelings emerge. And what you're saying is that feeling also can result into a thought, is it?
I think the modern research about how the brain processes information, especially the work of a therapist called Ledoux, Ledous. He wrote a book called actually, no, I can't remember the name of his book. But anyway, it basically, while it's true that if you have a negative thought, that can make you feel negative, 90% of the time, it's negative feelings that are making you have negative thoughts. And if you have a negative feeling and you try and eliminate that or control it with a positive thought, it doesn't have a strong effect or a very long-lasting effect, no matter how hard you try. Because your brain is wired for survival. So to give you an example, if you're walking along a pathway in the woods and you see a snake, and you don't know whether that's a poisonous snake or just a harmless snake, but your brain has to quickly say, danger, get away from that snake. So you don't have time to think, what sort of snake is that? You just go panic, whoosh, take off. So that's your emotional brain that does that. And later on you think, oh, that was just a harmless snake. I didn't have to react so much. But in the moment, your nervous system just wants to keep you alive. It doesn't care about the details. So always, when there is a danger, when there is a threat, your emotional system comes first. It activates to protect you. And then you think about it later. Does that make sense? I've lost your audio.
Oh, yep. Well taken, Mark. Point. Yeah.
That's all right.
Understood. So, Mark, continuing the flow of thoughts that you were keeping, that, it is at the emotional level, at the feeling level, we need to work with the chronic patients in order to change them.
Yes.
Yeah, you can continue, please.
Okay. So with this understanding, if you want to one way, and certainly meditation is fantastic, but it's hard work, as I said. So I'm always looking for an easy way I'm a very impatient person. I like things quick and easy, and I like to give that to my patients if I can. And I know as an engineer, you like to do things that are efficient, that make the best use of the system.
And that's what we get paid for.
Yeah, exactly. So you will like what's going to come. So if your brain is really primarily processing and producing chronic pain as a kind of memory, then we want to find the best way to change the brain activity. And this leads me to introduce EMDR, which was discovered 30 years ago this year, actually, by an American psychologist called Francine Shapiro, and who was suffering from some stressful events in her life. And she was walking in the park thinking about her problems, and she suddenly had a burst of saccadic eye movements, which is like spontaneous rapid eye movements, like what you experience in REM sleep. And then she noticed that after that, she felt calm. And then when she thought about her problems, it didn't bother her so much. And so she made a research, and she discovered that if you get people to think of traumatic memories and access the feelings, and then you stimulate rapid eye movement by getting them to watch, say, the therapist's finger going backwards and forwards, that they immediately start to relax, and they report that the memory and the feelings is completely altered, and that they feel it's not such a traumatic thing. They don't feel afraid. They can see that it's in the past, and their body is not in a state of agitation anymore, and they feel more calm and more confident. Now, 30 years ago, this was miraculous, and everyone's saying that there was a lot of skepticism around it, really. But there has been a lot of research now on EMDR as a treatment for post-traumatic stress disorder and other problems, and it's been found to be a valid treatment. And it stimulated a lot more of this research about how the brain works. And there are many, Shapiro believes that EMDR is stimulating an innate, what she calls an adaptive information processing capability. That means that we're all really designed to be able to heal, to process painful, traumatic memories, and to be able to overcome these things. But the problem is how to activate that. So she believes that. Tell me if this is too complicated or this is okay. Yeah. Voice.
This is going in the right direction. What I'm interested in, what's with the eye movement and going back to the memory, what's happening inside the head?
Okay, so
What's
I'm
with the
coming
eye
to that.
movement?
So how it works, how it works is like this. So when you talk about memory, we think of memory as what you had for lunch today, where you went to school as a child. Okay, but memory, there are actually two types of memory. There is what's called procedural memory and semantic memory. So procedural memory is how you ride a bicycle, or it's how you felt when you went to your childhood school. Procedural memory is to do with the body and feelings. Semantic memory is the facts, what you learned at school, what the name of the school was. It's the facts. So when we talk about pain or trauma, we're really talking about a memory that is more procedural, that is more felt in the body. And so to change a procedural memory, you need to find a way of deactivating the fight-flight response and putting new information into the system. And EMDR does that perfectly because of how it works, and I'll explain that. So when you're in a chronic pain state or traumatized, you're basically, your fight-flight response is continuously activated. It's always on. People with trauma or chronic pain, they never really feel any peace or relaxation. So EMDR, what it really does is it hijacks the fight-flight response.
Uh-huh.
So I'll explain what I mean by that. So when when you do that, when you stimulate the eye movement, right, you know consciously that you're just watching a finger go backwards and forwards. But the emotional part of your brain, where the fight-flight response originates, processes that stimulus completely differently. Your fight-flight response says, there's something moving out there, and I don't know what it is. And I don't know whether that's a threat or something that's nothing to worry about. So when we stimulate bilateral stimulation, as it's called in EMDR, initially there is an increase in brain activity, especially in the parts of the brain that deal with danger response, an increase. And then after a few seconds, your brain goes, well, whatever it is, it's not a saber-toothed tiger. It's not a poisonous snake. We can relax. So we've captured your fight-flight response, and we've deactivated it by tricking it in a way to get activated about something else. But because we need to say that when we do that, we're getting you to concentrate on the pain or the trauma, which are stressful things, and then stimulating the bilateral stimulation after some other preparation and assessment, which is much too complicated to explain here. So once you in the treatment you are thinking about your pain, then after some preparation and making sure you're okay, I get you to focus on the bilateral stimulation, and instead of feeling scared or upset or tense, your brain goes into a state of relaxation, not just about the bilateral stimulation, but about the pain, the problem as well. And you feel maybe a reduction in pain, in some cases no pain, and I can give you some case examples. And you feel healthy and well. So I'll give you an example. So a woman I treated recently was in a car crash on the motorway, and the car she was traveling in was hit by a big truck from behind, and it pushed her car sideways, and she thought she was going to die. That was for sure. She was going to die. And somehow the car didn't collapse, and she survived. But because of the impact, of the trauma, she had what's called whiplash pain. So right down one side of her body, she had a kind of tingles and burning sensations, and a lot of discomfort. And there was really no in the X-ray. There was no pathology. It was just from the trauma. So, and also, she had three of her best friends had been killed in a very similar accident 12 months earlier. So she was already a bit sensitized to these kind of things. So in EMDR, I asked her to focus on the memory of the accident and the image of the truck and the feeling, especially the pain that she felt in her body when she thought of that. It stimulated the bilateral stimulation, and really in one session, her pain and her trauma was all completely gone. And she said, it's over, I survived, it's in the past now.
Wow.
And that was it. So,
and then she didn't visit you ever again.
I saw her again for a follow-up session, but that was it. 2 sessions.
2 sessions.
And her doctor was very surprised, because normally whiplash pain, at the very best, 3 months, 6 months, a year. Some people never get over it. It can be a very difficult condition to treat. So that's the power of when you know how to work with the brain. Whereas normally in therapy, you would have said, well, tell me your negative thoughts and stop. I want you to challenge those thoughts. You didn't die. You're alive, and you would go on forever.
True. Yeah. This is quite an interesting take on using the rapid eye movement and calming down the mind, so I believe fundamentally what is happening, Mark, would be the association of that negative feeling or a dark thing that had happened with that particular pain gets removed, because your mind needs to know everything is okay. The things are moving, but the things are okay.
Absolutely. And especially the part of your mind that has the emotional memory, because that woman knows that she's okay. The accident is past, she's alive, but her body doesn't know it's okay. You remember what I said about the two, procedural memory and the semantic memory?
Right.
So in her head, she knows she survived and it's okay, but her body doesn't know that.
True.
We have to get that message into her body.
Hmm.
And if you just do talk therapy, you will be there for 10 years. But if you work with the body and with the emotions and the brain, it's very quick.
So, will this work, Mark? Just primary question. People with not having a chronic illness, using the same method somehow, to make them, get over the hurdles that they think are there in life, achieve success, and associate those, sort of the things that we perceive as a blocker to get over that. Will that work in those scenarios?
Oh, sure, sure. So since it was originally discovered, EMDR has been used for sports and performance enhancement. So so people often people have anxiety about failing or fear of success or something like that, and EMDR can be very helpful for those people to eliminate um, those kind of neurotic fears. And really, it's one of the most powerful applications of the method.
Wow. Does it also help in concentration like meditation does in calming down the mind? Calming down the mind is pretty clear, but
Yes, well, that's a very good question. So one of the key elements of EMDR is focused attention. You must be able to concentrate, otherwise the treatment doesn't work. So if you are very distressed and your concentration is very poor and you are overwhelmed by your feelings, you can't do EMDR. You have to have some emotional regulation training first. But in EMDR, it makes normally when you do meditation, you're using a specific kind of attention. When you in EMDR, you're using 4 different kinds of attention.
Mm-hmm.
You're using focused attention, you're using selective attention, you're using alternating attention, and you're using sustained attention. And those kinds of attention really require different areas of the brain to operate. So when you're traumatized or in pain or stuck with a problem, your brain is in a kind of shutdown state. Only a very narrow part of your brain is working. With EMDR, you're bringing online all the different parts of the brain to work together.
Right. Yeah, that completely makes sense, Mark.
Yeah, yeah.
So you have been specializing and working with the patients in EMDR, is it? What's your
Yes,
work?
yes. I work with a lot of people with medically unexplained pain.
Mm-hmm.
So they might have been people who've been in an accident, like one I just described, or it could be someone who has had a back injury and had a surgery and the pain has persisted, or it could be someone with a chronic health condition. And I use EMDR to try and help those people to reduce the contribution of emotional distress to their pain. Unlike the case that I described to you, a lot of chronic pain sufferers they're very complex presentations. They might have multiple health problems, traumatic backgrounds. They might have had some trauma in the hospital with the doctors. So with these cases, and they might have been in pain for years and years. So to be honest, you don't see those same results that I described to you with these patients. To be honest, they might be able to have a reduction in their pain, but not complete pain elimination. And they might need to learn some meditation, some relaxation, some hypnosis, as well as the self-use of bilateral stimulation from EMDR.
This topic is really fascinating, Mark. And I want to come to the point about your book now, which is
Okay,
change your brain and change your pain. Is it
sure,
is it
sure,
is it about this itself? And tell us something about your book.
sure, sure. So I wrote a book called Change Your Brain, Change Your Pain. it really teaches people not how to do EMDR, but how to stimulate their brain to change their pain by processing negative emotional memories, by learning how to manage their feelings, by understanding their feelings better, and by really creating a pattern of activities and feeling that reverses the brain activity that maintains pain. And I want to say that it's not an overnight process. It does require, in most cases, dedication and discipline and application. The book is linked to an app called Overcoming Pain, and that app has about 25 guided meditations incorporating bilateral stimulation, hypnotic suggestions, and some recommendations about exercises that people can do to change their brain, change their pain. One of the most exciting sessions on the app is actually a simulated brain scan of neurofeedback. So you see on the app, when you look at it, an image of what a typical chronic pain pattern is in your brain. And you simply lie back and watch that video for 5 minutes, and you get while you're watching it, you will see the pain transforming from chronic to brain activity associated with comfort. And while you're doing that, your brain is being bombarded with messages: change your brain, change your pain, feeling better. Yeah. And of course, if you do that once, probably not much is going to happen. But if you do that 3 times a day for 3 weeks, things start to happen.
Incremental changes.
Yeah. So I'm trying to bring onto the app what you would have to pay hundreds of dollars, maybe thousands, to go to an fMRI to have the same thing. I can't say the app is the same as that, but I'm trying to create that experience.
Fantastic, Mark. So, is that app freely available over the App Store, or it comes with?
So I have 3 apps, and that one is a paid one.
Okay.
It's about $10.
Mm-hmm.
I do have one free app called Sleep Restore, if people just want to try. And I have another one called Anxiety Release, which is my most popular app, because the bilateral stimulation is very good for managing anxiety. And in actual fact, have you got time for a quick story?
Yes, please. Yeah.
Okay. So when I made Anxiety Release, I made it for people with anxiety, but a colleague of mine was suffering from carpal tunnel syndrome, and she was in my office, and she said, "I'm going to have surgery. Nothing is fixing it." And I know not many people know, but carpal tunnel syndrome is highly correlated with anxiety. And I said, "Look, I think maybe your problem is anxiety as much as it is pain. Why don't you just try this?"
What is the syndrome, Mark? Sorry, what is the syndrome? What are the symptoms?
It's like when you have pain in your wrist from using the computer too much.
Mm-hmm.
We call it carpal tunnel syndrome.
Okay, carpal tunnel syndrome. Okay.
Carpal tunnel, yeah. So she took the app, and she was taking. By the way, she went away for 3 months, and she used the app. When she came back to me, she had no therapy, just the app. She said, "My pain is completely gone. I don't have to take any medication. I don't have to have a surgery anymore."
Wow.
So I wrote her case up, and it has been published in a magazine, a journal, and it is the first and only published account of someone using a mobile app to actually overcome their chronic pain. And I didn't even make the app for chronic pain.
Yeah.
But it shows you how pain and stress, how related they are. And if you can help someone to manage their stress, you can help them to manage their pain.
It's all about going into, delving into the subconscious and changing a small thing over there, which actually, has a bigger impact. I've been meditating for the past 3 years, and, somehow I've been trying to tap into my subconscious to find new ideas to innovate and stuff. So, I sort of understand how you can change your personality altogether and, you know, and then get in touch with your inner id.
Absolutely. Um, with EMDR, it's almost like you go straight. It's a doorway straight into the subconscious, and it's very effortless because really the obstacle to getting into the subconscious is the frontal cortex. It's a thinking mind, monkey mind,
Yeah.
And when you're concentrating on the bilateral stimulation in EMDR, it actually deactivates the frontal cortex because the back of the brain is going, what's going on? What's that about? And you go into a non-thinking mode. You're going into a perceiving mode. And like I said, your brain is designed to survive. So when there's nothing going on, your brain is turning around and it's worrying, it's ruminating, it's analyzing, it's doing all those things that the brain does. But when your brain perceives a threat, whether it's a snake on the path or it's just bilateral stimulation, it forgets about thinking. It has to go into that action mode. So that's the core. That's the really smart bit of this that is so consistent with neuroscience, that you're deactivating the frontal cortex so that you can work with the subconscious.
Subconscious, yeah.
And that's what we've been trying to do for thousands of years.
Yes, true. I completely agree. And slowly, I'm also starting to get this point that, everything is about tapping into your subconscious and getting to know the real you rather than what your belief systems.
Yeah, yeah. That's right. That's right. That's right. It's very exciting that there is a way to do it that is so easy. A lot of my clients say, in fact, I had an email this morning from someone in America who's using my anxiety release. Are we still going? Oh, frozen. Okay. Okay, lost you
Hey,
there.
sorry, my connection just went poof.
That's okay. We've been doing pretty well so far. So
Yeah.
I was telling you how easy it is, how EMDR makes it easy to get into the subconscious, because it just deactivates the conscious mind so quickly and allows you to get in touch with your feelings and to put new information in there. And just this morning I had an email. I get them all the time from a woman in America who had been using my anxiety release app. And she said to me, I can't believe that just after listening to this, I have no anxiety. I feel so different. It's so easy. She was really shocked because we because of the way we're educated, we think if a problem has been there for a long time, it must take a long time to fix it.
True.
But if you really have all the right ingredients, that's not necessarily so. If you know how the brain works and how to work with it. Now, of course, there are some people who have had really terrible trauma in their lives and bad childhoods, and they really need a long-term psychotherapy. They can't. There's no miracles like that.
Right.
But for someone perhaps like yourself, who is a well-adjusted, healthy, intelligent person, who maybe has some anxiety, some memories, it's can be very effective and very quick compared with traditional methods.
Sounds like a fantastic app there, Mark. I'm gonna leave the link at the bottom of this podcast so that
Thank
people
you.
can go ahead and download it and interact with you. So just the last point here, Mark. This tapping into a quick way to subconscious. I've heard many people talk about self hypnosis as a way to do that as well. What are your views on that?
Oh, you look, self-hypnosis. I'm a big fan of hypnosis, and I use it with a lot of my chronic pain clients who only have a limited response to the EMDR and who really need something in their day-to-day life to help manage their pain. So with self-hypnosis, you have to do it continuously, but it is a wonderful tool for managing chronic pain, and it has a lot of research to support it. I use it with a lot of my clients. It's an excellent tool. Again, the secret is it's not for everybody. Some people are much more, can we say, suggestible or open to it than others.
Mm-hmm.
And you have to have the right conditions. So to benefit from hypnosis, you have to be able to concentrate.
Right.
And you have to have a little bit of an imagination.
Yeah.
You're an
We never.
engineer. I don't know. I think you have an
Just
imagination.
in the last podcast, Mark, we had a lucid dreaming expert from Hungary.
Wow.
And he trains people to how to lucid dream, and then he also talks about the same thing. When I've got my concentration from meditation, then I take the next step towards getting awake in my dreams and then doing things. So everything boils down to concentration. That's very much, Mark. That's very true. And sort of out there is a war going on. That's my explanation is, the war is outside. We see all the advertising which is trying to gain our attention.
Yes.
Inside, it is our prefrontal cortex keeping us in past and future. That's the war. And the whole idea is to be in that present moment and choose where you want to give your attention to. So that's my.
Absolutely, Ash. And really, that is what we're trying to do with EMDR, as well as meditation. Really, they're all trying to do hypnosis. They're all trying to do the same thing, to help the person live in the present, and that means to be fully, in touch with your feelings, with your reality, in a way that's right for you, not a way that's driven by pain or traumatic memories. And it's a beautiful thing when you experience it, to feel fully alive and fully joyful and connected.
Right. At the times you feel, once you get that liberation kind of where you take that third person objector, observer place to your feelings, sometimes the life tends to seem a little bit boring because then you're not daydreaming, and then you slowly catch up and see that, oh, the true nature of life is this, and your true potential is so much.
There's a famous American writer, Arthur Miller. He said, if you this was, and he said this in the 60s, long before mindfulness was popular. He said, if you really concentrate on a blade of grass, you will see the universe.
Too deep. I need to dig, put my mind through that to understand. Overall, Mark, with this we have come a long way. It's about 46 minutes of recording that we are into, and our audience, we have seen that our audience likes it, within 35 minutes.
45 minutes.
35 minutes is going too long. And in that end, Mark, I'm going to quickly summarize what we have learned from you today. The idea of treating a chronic illness patient is about tapping into your subconscious by using techniques like EMDR, where you can quickly simulate the feeling where the person's original pain started, and then try to use the finger technique, the rapid eye movement technique, to make the patient calm. And that way you can reduce the anxiety and stress. We also talked about how different patients of yours are able to reduce their anxiety and stress by using such techniques. And then it's all, again, everything falls down to what your attention is, and how you're able to bring yourself to a present world in order to live a more meaningful life. Any final remarks, Mark?
No, just to say, you've done a great summary. I'm very impressed how you could remember everything and summarize it like that. And I wish you every success with your work. It's been a pleasure to talk to you, and I hope this helps some of your listeners with their anxiety or pain and stress.
Thanks so much for coming to the show, Mark. You're our first guest from the land down under. So it's been a real privilege to have you.
It's a pleasure.
All right, thanks, Mark.